we're able to lay emphasis on why, as pharmacist technician, we must ensure that medications are safe. We must ensure that even though the medicines are safe, but it is going through the entire dispensing process. Ultimately, why do we take medicines? Because we want to see a positive outlook of a patient, right? A patient is sick, a patient is unwell, they have a need for a surgery, whatever it is. Ultimately, what we want to see is a positive outcome, right? A positive outlook. The patient gets back to normal, gets back to well-being, perfect well-being and state of mind. So generally, we're looking at prescription medications. That's as a way of introduction. Please, next slide, sir. Thank you. Okay, so we have a very, very interesting lineup of course outline. We'll just briefly talk about some introductions. We'll define what prescription medications are. We'll take a snapshot on, the legal frameworks that support prescription medications, and we'll also look at what a prescription should look like. I'm sure you've heard this through several lectures, and that's because at the heart of pharmacy, ultimately, the legal authorization for you to act is a prescription, right? So we would also remind ourselves what the components of an ideal prescription should be. Then we'll now look at some classification around prescription medications. What classes do we have and all of that? Then, as a technician, what should our workflow look like? Then we'll finally look at things surrounding patient safety as well as counseling. Okay, so we'll go to the next slide. Okay, so introduction. So what do we have there? A pharmacy, as pharmacy technicians, or generally, right, our role is very, very integral into the medication pathway, from procurement to storage to dispensing and administration. And so I keep saying, even in my formal lectures, that the role of a pharmacist technician is not trivial at all. It's equally as important as the role of a doctor, a pharmacist, a nurse, or even a surgeon, a professor, of surgery somewhere in the hospital. The pharmacist technician's role is very, very important in ensuring that the right medicine is procured, in ensuring that the storage conditions for those medicines are correct. Beyond that, when it is given to a patient, is the right drug, the right name, the right color, in the right form, and ultimately how that is administered to the patient. So as a technician, you have no room for errors at all. You can't afford errors. I've mentioned that medication will have to be safe. Ultimately, when you think of prescription medications, you think about safety. I've mentioned that. Then process optimization. You're supporting the entire health system, not just the pharmacist. You're supporting the entire health system, to ensure that there is delivery and that the outcome that we require from any patients, from any process, therapeutic process, is achieved. And ultimately, we want to see people get better. We want to provide the right support system for them. We want to ensure that they have well-being, and they get the positive best out of any pharmaceutical process. Like I had mentioned again, just to recap, there is no room for error. So as much as possible, medication errors must be very slim. And although that is the ideal, but we still find situations where they happen. And once they happen, no matter how small, they constitute major risk both for the person that dispense as well as the patient, at the end of the chain. So remember, when you think of medications generally, you're thinking about safety. Please don't forget these words. You're thinking about safety, you're thinking about process optimization, like how do you make the best use of the process from end to end. Then lastly, at the end of it is the patient outcomes. These three things, once you can remember it, you already understand prescription medications. So let's go to the next slide, please. Okay. So let's look into some definitions, just very, very few definitions. What are prescription medications? Like I said, medications, drug, medicines, they're all, one and the same. So prescription medications are drugs that require authorization from a licensed prescriber before they can legally be dispensed to a patient. Now, if you've been in the dispensing class, you'll begin to hear some things that sound familiar. Remember, we had said you cannot attend to a prescription or or dispense a drug except it is being authorized, right? From an authority, within the health space. So it's the same thing with medicines. Prescription medicines must be gotten from an authorized prescriber, a doctor, a nurse, a surgeon, or anyone that has prescription rights before they can be legally, did you hear the word legally dispensed? By that is you doing it the right way, right? Right drug, right name, right title, right route of administration, and all of that. So another way that we can look at prescription medications generally, when you think of it, you can look at it in three brackets. Remember, I told you that prescription medications, ultimately, what we want is we want to ensure that there is safety, we want to ensure that the process is optimized, and finally, we want a positive patient outcome, right? So when they ask you to describe or define prescription medications, there are also three things you're looking out for. Professional oversight. Why do I say that? Is because we have said that it must be written or must be licensed by a healthcare provider. Bam, step number one. Without a license and prescriber authorizing, you don't even start. So there has to be a professional oversight. Then the second thing is that there has to be purpose. Why are we prescribing those medicines? Because we want to ensure that medicines with higher risk, by risk we mean they have side effects, they could have adverse reactions if there are any interaction either with food or interactions, drug to drug interactions otherwise, or even medicines that create dependencies, the codeines of this world, the morphines, even depressants, antidepressants, any drug that could create dependencies is seen as a prescription drug and must be used correctly and safely. So you're looking at, it has to have a professional authorization, it has to have a purpose. Then lastly, it has to be by a legal, it has to have legal binding. Legal binding means without a valid prescription, you cannot dispense. Bam! Without a legal authorization, you cannot dispense. So these are the key elements of anytime you hear prescription medications. That is what is being referred to. Okay, so let's go to the next slide. Why are prescription medications or medicines, or any way you want to look at it, why are they important within the setting, within the health setting? The first thing is we want to see improved outcomes. Why do people take drugs? I mean, no normal human being, right? We just want to take drugs just like that. There are instances where some people have medical issues, but a normal, right thinking, functioning person, just doesn't take drug for no cause. And so if you take drug, it's either because you're sick, it's either because there is an emergency, or is or you're put on a lifetime, you require lifetime support, treatment support, to keep you alive. So either way, we take drugs or we take medicines, in this case prescription medicines, because we want improved outcomes. Okay. Patient safety. All through my slides, you will keep on seeing patient safety. You know, Professional supervision ensures that there is reduction either in the misuse or harmful drug interactions. And so prescription medicines, it safeguards it's meant to safeguard. It has an element of patient safeguard. Okay, we want to be sure that for these drugs that there is supervision, either by the doctor, the nurse, or even by a caregiver within the house, right? The idea is that so that this category of medicines, we don't want them to be misused, because they are that sensitive and strong, and they could have harmful effect when misused. Okay. Now, these categories of drugs always have public health, outlook generally. When you talk about public health, it looks at the larger population, right? Is beyond an individual. It looks like the entire population, or it's looking into communities, diseases that affect communities or general population. So a lot of these prescription medicines help, in public health interventions. For example, um, antibiotics. Now, in recent time, I don't know about you, but you find out that if you take ampicillin, for example, or ampiclox, typical antibiotics that we know, you would take it all through the number of days, 5, 7 days, or 2 weeks. After a while, it's looking like the drug is not working. Why is that the case? Is because over time there has been so much abuse and misuse of antibiotics that we now have what we call antimicrobial resistant organisms, right? I don't want to go too deep into that. And so these organisms are in our systems. And so when you take antibiotics, it's like the thing is not working. So you keep having to go to the next stronger antibiotics. And even that, it gets abused, it gets misused. Why? Because people can easily just go into a pharmacy and say, I beg, give me ampicillin there. I beg, give me ampiclox there. Bam. You take, they say you should take it for 7 days. After day 3, you're feeling like you're getting better. I beg, Joe, you just drop the medicine. So abuse, misuse, or even underuse, these are things that over time, it evolves and becomes a public health issue. And so prescription medicines generally need to be safeguarded so that they don't contribute to public health issues. Okay, so that's a third importance of why we need to study prescription medications. Then these categories of drugs also are controlled substances in some instance, in some classifications. And so you need to control access to them. And that is why maybe when you go into a pharmacy for some of these drugs, you see that they're kept in a special place, locked under key and padlock. Only one or two people have access to it, because you want to control them. You want to reduce access to prevent, misuse. Typically, you have opiates, steroids, anything that stimulates, adrenaline pumping, like generally anything that will act as a stimulant, is always kept in a cupboard in a safer environment to prevent access. Then lastly, we need to study prescription medicines in healthcare, because we need to build in trust into the healthcare system itself. Patients need to be sure, they need to be confident that medicines that we dispense to them are regulated, no, really, and safe, and appropriate. Imagine a system where, everybody knows that everybody can get any form of drug they need out there. It will just be, a bunch of crazy people, like literally no control, and that would be scary. So in order to build trust and confidence, that when you go to a pharmacy or you go to a hospital, you're sure that the drug that they are giving you is being regulated, is being kept safe, is being appropriate. Have you wondered why, for example, some people will choose to go to certain settings than others, right? Some people will prefer to go to, one pharmacy where they will pay 5,000 for the same drug. Then there's another, right, where they will pay maybe 1,000 for that same drug. There has to be something, right? There has to be a value that they are getting from here. Maybe because they feel the quality is better, the drugs are regulated, they are safer. So, generally, the system itself, the healthcare system, has to be able to provide an environment that people feel that the medicines that they are taking are safe, they are appropriate, and they are regulated. Okay, so remember, why is prescription medicines important in healthcare setting? We want to improve outcomes, patient safety, and it's used in public health, for public health control. Okay, so let's go to the next slide. All right. So prescription medication, kilo day, why? Like, why prescription only? Like, what is the fuss about it has to be prescribed, it has to be authorized? We just keep going on and on about the same thing. There's a reason why there are some drugs are called prescription only. Yeah, it is tagged prescription only, meaning that if you go to a pharmacy, for example, and you say, give me paracetamol. Have you wondered? Give me paracetamol. The pharmacy will say, oh yeah, now, how many cards do you want? Even though that's not the ideal, but they'll say, oh yeah, you have a headache, take three, 2 to 3 for 3 days. Okay, that's easy. Or you go and say, give me what give me anti-malaria. I'm feverish and all of that. You get your anti-malaria, but you go and say, give me diazepam. The next thing you hear, where is your doctor's prescription? Right? It means that even within the setting, there are some drugs that you can easily get over the counter in the pharmacy or in the hospital, where there are some drugs, so like you cannot get it except you show a prescription. So we call them prescription only medications. Like, why now? What's the fuss all about? Is because these particular categories of drugs, they pose significant risk if not monitored. Chicken, if you don't monitor them, they pose significant risk. What does that mean? They have potential for harm either by when they are misused or they are not taken under medical supervision. There are some drugs in the hospital setting. They will not even give you those drugs to carry home. You will have to take it in the hospital. Like, you will have to be an inpatient. A nurse is there. Is a nurse that will have to administer it. Because it has to be under strict supervision. High risk drugs, potential for harm, and so those kind of medicines are called, they fall under the category of prescription only drugs. I had mentioned they require regular monitoring. For example, anticoagulants. You know what anticoagulants do? They help in thinning the blood. So you can imagine if you give, people, just like, you can't even give it because it has cardiovascular. I don't know if you've gotten there in anatomy, but it has high risk for heart related issues. You don't want your blood to either coagulate or be rushing very quickly. There has to be a balance in how blood flows to the heart and how it comes out. It pumps out from the heart. So anticoagulants can never be given even outside a hospital setting. It has to be under strict monitoring. I know that in the past, even insulin, you it has to be given within the hospital. But these days I see that medicine has evolved. People actually go home with insulin, but they are monitored. The doctor or nurse will say they will have to take charts of when they take it, what meals they put, and all of that, because these are drugs that have the tendencies to cause harm if not properly used. Finally, again, like I said, they have abuse tendencies. For opiates, what steroids, benzodiazepines, for depression. And so anyone that's, Nigeria happens to them, they just want to take antidepressants. We don't want that. And so these drugs are called prescription only because they have high risk, they have potential to harm, and must be regulated. Now, I had mentioned over the counter, just to let you know that, again, to reemphasize that over the counter drugs are different because they have, it's believed that they are safe for self treatment. Like, they're just safe drugs. They don't have any risk of abuse. You know what I mean? Why will you take paracetamol if you don't have a headache? I've never seen anyone do that. And literally, they don't need prescription, so to speak. These are over the counter drugs. Literally, when you go to a pharmacy, you're in front of a counter, right? The name applies, over the counter drugs. And they can really be prescribed by anyone, and they are safe. So that's the difference between over the counter drugs and prescription only drugs or medication. And I'll ask this in exams too. So remember the difference between over the counter drugs and prescription only medications. Okay? So let's go to your next slide. So we want to look at, let me pause here. Does anyone have any question? Let me just pause. Any question? Yes, Alice, please. Happy to take your question. Hello?
Hello, can you hear me now?
Yes, I can hear you.
Good evening.
Evening.
The OTC drugs. Here in Nigeria, the people, you were saying something about drug that we can buy from the OTC drugs, but also here they also sell drugs. They can also do. They also do give out cough syrups or cough medicines or codeine that contains codeine that could also be
Mm-hmm.
harmful, also cause some kind of harm or hallucination to people.
Mm-hmm. Mm-hmm.
In this
I
case,
agree with you. Mm-hmm.
yeah.
Mm-hmm.
So in this case, also it's also OTC. I'm also referring to that. It's also OTC drug too.
Iris, that's a very, very brilliant, and even you've brought it down to reality, and that's something that all of us can identify with.
Yeah.
Codeine drugs or even tramadol. You know that
Yeah.
before now, it hasn't always been illegal. Like, it hasn't always been a prescription only drug. Before, I
Okay.
don't know about you, right? I don't know what year we were born, but during our own time, like our mothers, you once you just have fever or you just quack quack small, bam, they just go to pharmacy and buy a cough syrup, and they buy, they'll give you cough syrup, vitamin C, paracetamol. I mean, those were just, almost, you could almost tell that once a child has fever or they're coughing, this is the combination of drugs they'll get from the pharmacy, right? So over time, our young people through tests, and so it was safe. It was okay because it's in a bottle. You give a mother, she takes it 3 times, she gives her child, the fever has gone, the child has stopped coughing, the mother just leaves it. I don't know if you remember, they'll keep it in the fridge, you're making me think back. They will keep it in fridge and everything is fine.
Yes.
But then our young people start exploring. Now, I honestly, now that you've asked me, I will go back and do that research. Then our young people started exploring, and then boom, they discovered that when you take one, two, three, four, heaven knows how many bottles of cough
Yeah.
syrup that has an active ingredient called codeine. The thing knocks you off. And of course, it's cheaper now. I assume it's cheaper than the conventional hard drugs. And
Yes.
so before people knew it, you will see. So cough syrup is meant to be for a small child, Abby, between a certain age, 3, 4, to maybe 6, 7. You will see
Yeah.
a full-blown adult, Kilode, come to the pharmacy, give me 1, 2, 3, 4 bottles. I don't know if you get my point. So clearly there was an overuse of this cough syrup in a particular category of people that have no business whatsoever taking those cough syrup. And so with that came investigations, and of course we are where we are now. The codeine component of it was flagged as what our young people were abusing, to stimulate, of course, to get them high and all of that. Then it moved from over the counter to prescription only medication. So you can see. And why did it move from over the counter to prescription only? Because they wanted to be controlled to access. Remember the things that I told you, as to the importance of prescription only. They wanted to be control to access, basically. So right now in Nigeria, the ideal thing is, once for you to get a cough syrup from any pharmacy or any hospital, it has to be on the basis of a prescription. They will have to look at you, you're a young person. You know what I mean? A lot of scrutiny will be made before that drug is given. In fact, my brother, in fact, over time, other medicines have been produced that have little or no codeine content, still providing the same therapeutic effect, in solution in for cough and all of that in pediatric patients. So that is one classic example of a drug that in Niger was misused, that made that gave a legal framework, and it moved from over the counter to prescription only medications. In fact, for the likes of tramadol, say, for example, it's even illegal. I don't know if you get my point. They catch you as importer exporter.
Yes.
Yes, now if you're
Yes.
if you're caught, bringing it into the country, you are in big trouble. So these are one of the downsides of misuse and overuse of drugs that causes a policy change, right, in how these drugs are handled. Classic example. Thank you so much, Aris, for bringing that very helpful contribution. Thank you.
Thank you, man. Thank you, man.
Okay, well done, you did well. Okay, so let's look at the last what we'll be looking at, I think, for today. The last slide, we'll be taking it small, so that we're in internalizing, and we go home and reflect on all that has been said. So we look at legal framework. Legal framework. It's like policies. It's like, they provide boundaries. Don't do this, do this, within the ambient of the law. If you go outside it, bagam, that's problem. So, we had mentioned in our previous class, for example, that we have some regulatory agencies in Nigeria. We have NAFDAC. Remember I said NAFDAC has to do with food and drugs. If you remember, we spoke about PCN, Pharmaceutical Council of Nigeria, that looks at the actual pharmacy practice. Remember, we mentioned that PCN has to do with regulation, has to do with the practice. I even say has to do with the human being, trainings, accreditations, and all of that. And NAFDAC has to do with the food itself, the products, starting from manufacturing, importation, processing, and all of that. So those are the two prominent regulatory agencies that we have in Nigeria. Okay. So and honestly, these bodies, generally they are being established to ensure that there's governance and there is strict regulation and adherence to ensure that medicines are safe. Because medicines should be safe for people. People should have confidence into what they ingest as medicines. So let's when you think of drugs or medicines, how they are categorized generally, I had mentioned two. I will add one more. So drugs can be or medicines can be categorized into three. Remember this one, oh, is another exam question. Drugs are categorized into three. We have prescription only medicines, which we're talking about right now. And we said you can only get them through prescriptions, correct? Then we have over the counter medicines, OTC. They are safe for general use, and they can be used through self administration or self treatment. Now, the third one that I haven't mentioned is controlled drugs. Controlled drugs. Now, these drugs are classified drugs, and they have even more stricter rules for application. And these drugs could be narcotics or psychotropic drugs. So this course is 105. On Sunday, we'll come back and look at 106, which speaks to prescription medicine specifically for control medicines or drugs. So I won't say much about that. We'll look at it on Sunday. But remember, drugs have three broad categories, or medicines have three broad classifications. You have prescription only medicines, you have over the counter medicines, and you have controlled drugs, right? If you give me these three, bam, you have passed my exams. So please don't forget, right? Okay, so let's look at when prescriptions, we're talking about prescription medicines. Let's remind ourselves what categorizes a prescription, because it's important. Because we've said prescription medicines are only given when there is a prescription. So just a reminder, what should a prescription be, or what should it look like? I know we've spoken about this. I know other lecturers have mentioned this. So it's just to remind you that a prescription is only valid when it is authorized by a health practitioner, right? Or an authorized staff within the health sector. So a prescription is only valid when it's a licensed pharmacist the signs off on it. That is one. Secondly, it must be dispensed by a licensed person. So either you as a technician or a pharmacist, literally based on the standard, these are the two persons that are authorized to dispense medicines. I know in some settings that you have some exceptions, but by the books, the two people that are licensed to dispense medicines are a licensed pharmacist, of course, with support from a pharmacist technician. So a prescription should be given by a licensed prescriber and must be dispensed by a licensed pharmacist. Okay, it carries legal warning because it must and they have potential for harm. So on the prescription you have to see um do not take while driving, or do not take before driving, right? You've seen those kind of warnings. Do not drink before driving or while driving. Make sure you eat before you take. Do not take in addition with vitamin C, for example, because there will be interactions. So it has to have some warnings, if there is a potential for side effect, or there could be interaction with another medicine or with food or otherwise. Then lastly, these prescription medicines are tracked. They are tracked. No matter the hospital that you see, as long as a drug is called prescription, I tell you, I kid you not, there's a register where they are tracked, where entry is made. If NAFDAC come to the pharmacy, they will ask for that register, like it is, it is a required practice that prescription medicines are registered, they are tracked in accordance with the law, right? So again, don't forget valid patient. By patient, I mean name, age, sex, all of that. Valid prescriber, a doctor, a surgeon or consultant. The date of issue has to be valid. It cannot be forever. If it's PCM, even though it's not a prescription drug, let's say it's an antibiotic, for example, it must show when you take it and when you end. For taking for 2 weeks or for 21 days or for 7 days, depending on what you're treating. We must know what is the strength of the drug, and finally provide clear directions for patient use. Okay. So we've spoken a lot for now. Does anyone have any question? Let me pause again if there are any questions or any addition or any new context that you want to add. Okay. If there's no question, I'll call names and I'll ask question. Okay. So let me ask Rose. Hi, Rose. Can you hear me? Hello, Rose. You're there, right? Excellent. Okay. Please, can you speak up? You can unmute. Hello, Rose.
Hello, ma.
Excellent. So what is
Sorry, I was busy.
it's okay, dear. It's okay. So what's one of the when we talk about the importance of prescription medications in healthcare setting, like what's the one of the reasons that you can remember? Why is prescription medications important in healthcare settings? Hello, Rose. Okay.
Hello, ma.
Yes, in Poker.
She's at work. She's busy. She's at work.
She's multitasking. Oh yeah, now,
Yes.
darling friend, bail her
One of the
out.
other women.
Mm-hmm.
Okay, what is two on one time?
Mm-hmm.
2,000 something. Come on. It's for the safety. It's for our safety.
In fact, five marks. I've added 5 marks to your name. I've just put 5 marks on your name. It's for patient
Thank
safety.
you.
Yes, safety.
Yes.
At the health of any,
One
as a
one.
pharmacy technician, the safety of the patient is your of optimal importance to you. So yes, it's
Yes.
important because we are looking at patient safety. Thank you, Iwon. Anyone
Okay.
else? Let me
Welcome.
see. Precious. Let me look at your names. Precious.
Good evening, ma.
Evening. How are you?
I'm fine, thank you, ma.
Okay, so tell me one reason. Another reason. It's 5 points, so that is at stake. So tell me,
Okay,
what's another
it
reason? Mm-hmm.
it ensures that the patient receive the correct medication, dosage,
Okay,
and instructions. Yes.
excellent. So you get the correct dosage, the correct medications. What will that do ultimately? At the end of the day, what will that give? Hello? Hello, Precious?
It will. Can I?
Ma, can you
Okay.
hear you?
Yes, Iris, I'm coming. So Precious, can
Uh,
you hear me? So you give. I agree with you. You've gotten 3 points. There's one more thing you need to tell me to get your 5 points. You've gotten the right drug, right? The right medication, the right dosage, correct. So all of these things will translate to what?
What's their health? Okay.
Excellent. The right outcome, Abby. You're
Yes, ma.
correct. Good. The patient outcome that you desire. You want the patient to have well-being, right? Restored
Yes, ma.
health. Have they're back to their health and well-being. You see, so you've gotten your 5 marks. Well done, Precious. Okay.
Thank you, ma.
Aha. So let me ask one last question. What's the difference? And anyone can answer me apart from Precious and Poker. What's the difference between over the counter and a prescription only medication? Should be simple. So, who will give me that answer? Rachel, I haven't heard your voice. Hello, Rachel. Are you on the call?
Yes.
Aha. So give me one difference between a prescription only medication or medicines and an over the counter drugs.
Okay.
What's one difference?
The prescription drugs are only like prescriptions, like
Okay.
tried for it, and over the counter drugs are available without prescription.
Okay. I missed you a bit. Can you please repeat what you said?
Prescription drugs are like given without prescription, then over the counter are given without.
Yay! My students are on fire today. You're very correct. You're very correct, and you have 5 points. Simple. Prescription drugs are given only with, prescriptions, and over the counter can be issued, through self treatments and not necessarily with prescription. Rachel, you've done well. So, one bonus question for anybody that will be quick enough to answer is a bonus question. I had said that there are three categories of three drug categorization. I said drugs or medicines can be divided into three categories. I believe I said so. So, who will be the fastest person to tell me the three categories?
There's controlled drug,
Mm-hmm.
prescription medication,
Mm-hmm. Mm-hmm.
medications.
Mm-hmm. Mm. Oh my God, you've made me so happy. Like you guys definitely heard all that I said. Excellent feedback, brilliant participation, and I'm really pleased. So I hope we've learned something new, from all that we've said today. Please do not forget, right? Prescription only medications, they're that way because they have potential to cause harm. They are high risk. Remember what I said, and so they need to be controlled. We said they are important within the care setting because we want to see improved outcomes, right? I believe it's Precious. Yes, Precious told us that we want to see patients get the kind of treatment they need by taking the right drug and right dosage for improved outcome. I believe it is Iwekoka that mentioned safety. That is correct. Patient safety, we don't want them to misuse the drug. We don't want a situation where drug to drug or drug to food or anything, there'll be interactions that will cause harm. I had also mentioned about public health control. And Iris gave us a brilliant example, right, of what could constitute a public health issue, the abuse of codeine and tramadol, and that led to a policy, decision for it to move from over the counter to prescription only medications or even controlled drugs. In some instances, we said, We want to control access. Nobody should have access to it. And we want patients to be rest assured or to have trust in the practice of pharmacy and our processes. That anytime we give them drugs, these drugs are regulated, they are safe, and they are appropriate. Okay? Yes. So I think we'll stop the class here today. Thank you all for coming in so early. We will
Thank
meet
you, ma'am.